and welcome back to the Nontraditional Nurse podcast. I am Ellie, and today I'm excited to have Kris Baird with me. So thank you for joining me today, Kris.
Thank you for having me, Ellie. I love the fact that you've created this whole enterprise around non-traditional nursing.
Well, thank you. So, Kris is a nurse, author, entrepreneur, and nationally recognized leader in the patient experience and healthcare culture space. She started her career at the Bedside and then went on to build Baird Group, where she helps healthcare organizations improve culture, leadership, and patient experience. So, today we're going to have kind of a twofold conversation about the patient experience space, as well as really just being an entrepreneur, because I think you have a lot of great things to share. So we'll get started. You've worn a lot of different hats in your career, bedside nurse, consultant, author, entrepreneur, just to name a few. Can you give us an overview of how your bedside nursing career really led to all the opportunities that ended up following?
Wow, that's such a great question. Bedside nursing really gave me the direct insight into what matters to patients, right?
Yeah.
It also gave me insight into how healthcare really works. And I think the other piece of that is that bedside nursing really instills confidence. You have to learn to deal with a lot of people. Every time you walk into a room, it's a different personality, it's a different set of needs, it's a different family. You have to learn how to communicate well. And I think that so many people I've seen go into nursing really grow in that respect. And I really think that helped me a lot.
Yeah, that is such a good point. You have to be able to think on your feet, and you just never know what you're going to see next.
You don't. And having to deal with conflict,
Yeah.
having to deal with, different levels of authority and perhaps, serving multiple masters, if you will. You've got your doctor, you've got your boss, you've got administration, and you have to understand how to make things work.
Yeah, absolutely. And before you started the Baird Group, you had an interesting segue where you were driving change from inside the actual organizations that you were working at as a nurse, if I understand correctly. So could you kind of just walk us through your path and explain the difference between intrapreneurship and entrepreneurship?
Yeah, absolutely. So from bedside nursing, I transitioned into marketing and business development. And I learned very quickly that you don't build business if you don't have happy patients, right?
Yeah.
They might show up once, but they won't be back again, right? And so it really shed light for me on, what it takes to build a positive patient experience. That intrapreneurship was really when I was in business development. Even before that, I was working in health promotion and I saw opportunities. Like one thing that I did was to start a daycare center within the hospital because I said, if you want to attract and retain nurses, you've got to understand what are the biggest stressors. And a lot of times it's childcare. And so I had a CEO who gave me free rein, said, yeah, that's a good idea. And the CFO is going, wait a minute, where's the ROI on that? And I said, wait, not everything has to earn a profit, but it can have a huge ROI with retention. Anyway, the difference between intrapreneur and entrepreneur, I learned very quickly. When you're an intrapreneur, you're building businesses inside an organization. You're developing new businesses like a Center for Women's Health. That one was my baby. But somebody else was paying the bills.
Yeah.
When you're an entrepreneur, you do a business plan and you get things rolling. You do the market assessment, you bring people to the table, everything from the building to the operations to the marketing, all of those pieces. But the risk is held mainly by the system, right?
Yeah.
As an entrepreneur, you're out there. It's you, your idea, your risk, right? Your
Yeah.
business plan, you making it happen, but the money, is all you, right? Or you have to raise capital some other way. Now, I bootstrapped when I started my business, meaning, it was me from the word go.
Yeah.
I didn't borrow money. I didn't, seek capital, but I knew that I had to make the numbers work.
Mhm. Yeah, what a special thing to be able it's almost like a gateway into entrepreneurship. You can learn a lot of the business lessons, but I mean, so many people don't have the capacity to take on that whole risk right at once and just, completely jump off the cliff. So, that's a
And
great
for
thing.
me, I had written a book that was actually, I finished it in 98 and it didn't come out until 2000 because it got stuck on the publisher's desk. But it was from the American Hospital Association and John C. Wiley. They merged. And what it was really explaining the pathway to build a better culture and patient experience. And that really opened the door for me to the business. And even before that, my master's thesis was on studying patient perceptions of quality in clinical settings. And so those things led me down a path where I became really engrossed in patient experience. And it was the bleeding edge of it, truly.
Oh, yeah.
We didn't call it patient experience then. I was calling it customer service in healthcare. And, back then, it's like, don't call them customers. They're
Yeah.
patients. Well, no, they're not. If they can stand on their own 2 feet and walk out the door,
Right.
you hope they're your customer, but they're a
Yes.
consumer. And so we had a lot of growth as an industry from those humble beginnings to where we are today with patient experience.
Yeah, you were a groundbreaking nurse in that space, certainly, which is so cool to talk to you about it. And patient experience, I feel like it's such a buzzword. We hear about it all the time, but I don't know that it's super well understood. So, can you talk, as an expert in that space, what does true patient experience mean beyond just the satisfaction scores that we get preached about all the time?
Ellie, that is such an important question. And I'm so glad that you're bringing it to the forefront because I think a lot of nurses hear patient experience and they go, no, they're being
Yeah.
beat up over
Hmm.
scores,
Yeah.
right? And patient experience is really the culmination of every single touch point that a consumer experiences from the point that they're feeling symptoms and deciding to reach out all the way through, did they go? Did they have a virtual appointment? How were they treated? How did they feel? And a lot of it comes down to, did you trust the people that you came in contact with? Because if you trusted them, you're likely to say, yes, I'd recommend. And yes, I would definitely go back. And when we look at patient experience, it's important to understand how the brain works in decision making, right? We've got the neocortex part of the brain. That's the thinking brain. That's the analytical thinking, right? This is
Yeah.
where I'm not feeling well. I've got these symptoms. I need to reach out for help. Where do I go? Well, I might go to Google, Yelp, right?
Yeah. Chat GPT these days.
Health grades, to look for a provider that I think I need. But here's the where the rubber hits the road is the limbic system of the brain. That's where you're processing emotion, right?
Hmm.
This is where you're processing emotion, and emotion is more directly related to how people will behave, right? I
Yeah.
might cognitively think, oh, I'm going to go to this doctor because she has these qualifications and she's double board certified. What happens when I reach out for an appointment? If I'm treated poorly, if I'm hung up on, if I don't get through, my emotions are kicking in and I am thinking, they don't have time for me. I don't trust these people. They don't even answer their phone, right? Or
Yeah.
I make the appointment and I'm sitting in a waiting room, or people are rude to me, right? They may have the best credentials in the world, but they didn't meet my emotional needs. They were rude to me. They made me feel discounted. And
Absolutely.
so when we look at patient experience and we look at it a lot through the mystery shopping that we do, we're looking at facts and feelings. So when somebody says, and one of my favorite quotes was, I was talking with an organization about hourly rounding, and they wanted to track their hourly rounds. And so they would have the nurse scan the bracelet when they came
Mm.
in to do hourly rounds. And we had a mystery shopper in with the patient, and she turned to the patient and said, "Okay, the nurse was just in here. What did you think of that encounter?" And he said, "What encounter? She scanned me like a loaf of bread or a pack of gum." And so when you can take those feelings that are expressed and bring them back to the team and say, when you do this, it causes this. We're not, you can scan the bracelet, but what do you do to make that encounter, make that human being feel like they matter, right?
Yes, that is so, so important. And yeah, and I'm glad you brought that up. And I want you to just super quickly explain the mystery shopping because I found that to be such a cool part of your business and something I didn't even
Sure.
realize was happening.
Well, first, let me tell you how it was born
Okay,
in my
sure.
company. I was doing consulting and going into these organizations, and a lot of times they'd say, "Yeah, yeah, yeah, we know what our problem is." And I'd say, "But do you really? Do you see the disconnects that are happening?" Okay, like for instance, if I walked through your campus on a Sunday afternoon, did you know that this is how your emergency room looks at 2 o'clock on a Sunday afternoon? Do you realize that these signs and the parking creates a bad experience before we even yeah, 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 we know all that. So we started going in early and snapping photographs, right?
Okay. Yeah.
Of things on the campus, and then looking at processes that didn't make sense. There was one ER that we mystery shopped that everybody was sitting there with a urine specimen. And what they did was they said, "Well, we know we'll probably need a urine specimen anyway." So when people checked in, we just had them get a urine. And instead of turning it in at the lab right away or the little pass through door, they said, "No, just hang on to it." So here's an ER filled with patients holding full cups of urine. And I have a picture, not of the person's face,
Yeah.
but imagine what an impact it made when we came back and said, "Do you see this photograph? The left hand is holding the container of urine and the right hand is eating chips."
Yeah. That
So a
is,
picture paints 1,000 words. So when we would go into organizations, and a lot of times people would say, "We know what the problem is. It's X, Y, or Z, or it's waiting time." No, it's a waiting experience. So we started going in and doing, acting as a patient or a family member, and having an ethical approach to it too. So we do it by phone. We do mystery we're calling for appointments. We're calling for information. We might make a patient visit for non-life or limb threatening situations. We may pair up with a patient and observe as, a family member or a friend. But we're hired by the systems or the hospital, the medical practice to evaluate them, and mystery shopping's been used for decades in banking and hospitality and things, but there's very few of us that do healthcare, and there's a reason for that because there's a lot of risk, right? You got to
mhm.
know what you're doing, and you have to also do it ethically so that you don't stress an already stressed system, right?
Yeah,
You want to get
absolutely.
the information and be ethical about it.
Yeah, I just found that to be such an interesting perspective because, I haven't used the healthcare system a ton myself, but going through, having a child and being on the patient side of things, you almost feel like a mystery shopper, right? You're like, I have some notes for you.
Yes,
Yeah.
exactly.
And it's something, I mean, we just know the other side. So we know what could be done better or what was, really exceptional about our care. So I found
And
that to be a really cool part of your practice.
yeah, and being a nurse has added a lot of credibility because I don't know one other medical mystery shopping group out there that is founded by a nurse,
Yeah.
right?
What a
And managed
differentiator.
by a nurse. Because the thing about it is that over the years we've developed over 2,000, a library of 2,000 scenarios
Yeah.
that you can use as a mystery shopper. And we have a certification program, with thousands of mystery shoppers across the country, right? And as a nurse, I'm able to stand up to whoever is scrutinizing the data and stand my ground and say, this is the scenario that was used. This is why it's appropriate for this particular specialty, etc.
Yeah, very cool. And I love when you talk about patient experience and really the culture of the hospital. I think there's a lot of, issues we see online about nurses not feeling like the culture is great in their organization and that being really tough. So, what do you feel like are some of the biggest culture blind spots that you keep consistently seeing across healthcare systems?
Leadership, leadership, leadership.
Yeah.
I mean, seriously, when you look at what distinguishes a very successful organization from those that are not as successful, the culture is going to be pivotal
Mm-hmm.
in determining your patient experience scores, your turnover, your employee engagement. All of those things come right back to culture.
Yeah.
And so, when we're talking with organizations, we're looking at, okay, how can you stop the most common cash leaks? Look at turnover.
Oh my gosh. Yeah.
Yeah. So, and that goes back to culture. So,
Mm-hmm.
did I answer your question?
Yeah, it makes a lot of sense because I think there's leaders that, made me want to leave my jobs, and there's leaders that I would have stood by through anything because I knew they were,
Exactly.
really advocating for me. So that makes a lot of sense.
So one of the things that after I was doing the training and development to improve patient satisfaction on the front lines, we realized without good leadership, you aren't going to make this happen.
Mm-hmm.
So being able to build managers, directors, even the executives to a level where they will drive the culture, right? So, one of the things I did as an entrepreneur was develop a curriculum called Be the Leader Nobody Wants to Leave, right? And it's helping either new aspiring or aspiring leaders all the way to CEOs. What are the fundamentals that you have to have in place so that you can decrease turnover, build loyalty, build engagement, and improve patient experience at the same time?
Yeah, that's wonderful, especially having that nurse perspective behind it, I think is so important with nurse leaders. And we talk, about the culture issues. And I think there can be a lot of frustration from nurses that see a lot of problems, but don't really feel empowered to fix those problems. So, what is a way that you think nurses can really influence culture and patient experience without having that formal leadership title? Is there a way to do that?
I love that question because you can be a strong leader from within, right?
Mm-hmm.
And I think and I love the fact that you use the word influencer. When people hear the word influencer, they're thinking TikTok, they're thinking, social media influencer.
Mm-hmm.
And I would challenge every nurse to flip the thinking on that and don't look outside, but look inside first, right? And how can you be a good influencer? Start by thinking about who influenced you the most positively in your career. What is it that they did? And how can you imitate that? Right. And so most of the time when I ask nurses that, who had the biggest impact, start to look at what they did and be more like that person. So I hear often things like they were very honest, they were trustworthy, they really walked the walk, right?
Mm-hmm.
So modeling the behaviors that really reflect your values and staying close to your values. Know what they are and act on those every single day. So, but again, starting with who do you feel you followed and was a great influence on you? How can you be more like that person? And I think the other thing too is being a leader means also being a teacher. And
Mm-hmm.
how can you support the nurses around you in a positive way? I think that leading from within and being an influencer starts with, staying close to your values. But one of the key skills that I think all of us can benefit from, and especially nurses interested in growing, is enhancing your own coaching skills. right?
Yeah. I love that exercise because I think, you really have to think more about why you loved someone as a leader and a teacher, and then it can come full circle and then you can be that for someone else. And I think that is like such a special thing.
It is. And I encourage nurses to journal a lot, to
Yeah.
think about, why did you choose this? What
Hmm.
fills your cup? Who was influential? We don't take enough time to reflect. And when I wrote the book, Reclaiming the Passion, stories that celebrate the essence of nursing, that's one of the things I really encouraged, is that they take the time to reflect and think about, what is shaping your career now? And, who are your influencers?
Yeah. And I think that's so important and something, I talk to nurses about when they are looking for non traditional roles. It's like, getting a remote role isn't necessarily going to fill your cup. You really need to think about what you love about your current job and what you might love in the future, because I've seen it both ways where people absolutely love their non-traditional roles, or some people are like, wow, I missed the bedside because they didn't, find a nice fit. So I think that, journaling, discernment is so, so important in making those moves for sure.
Yeah. And the thing is that nurses have been influencers throughout your career. And
Hmm.
we're influencing patients to take better care of themselves. We're influencing them to take their medications. We have
Hmm.
those skills and build those skills throughout our careers. And when it comes to how could you get more involved in patient experience, really understanding what makes a good patient experience, understanding the standards of behavior that make a great patient experience, and then becoming a coach for other people. And that might start in the beginning when you're a preceptor, let's say, for somebody. That precepting can be very helpful, because you're not just working on clinical skills, you're also working on, this is the way we do things around here,
Hmm.
right? And so you're becoming a coach, and you're spotting, you're giving feedback, getting comfortable receiving feedback and giving feedback. Those are things that can really help you get more involved in patient experience. Understanding the HCAP scores is important, but there are people that are the number crunchers. There are analysts in
Hmm.
a lot of organization, and that's all they do, is they go through the surveys, they understand the numbers, they look at, okay, this department is struggling in this area and that. But again, that's reactive rather than proactive.
Sure.
And so being a leader in, what are the behaviors we need to see more of, and really modeling that and then coaching that. Because coaching, mentoring, modeling, and managing behaviors is what makes organizations most successful around patient experience. And I came up with a curriculum for nurse coaches, where the nurses are the ones at the bedside coaching other nurses. They're coaching doctors, they're coaching phlebotomists, they're coaching anybody who comes in contact with a patient is
Wow.
fair game for coaching. So some of the organizations that have adopted that have seen incredible spikes in their patient experience scores, and a reduction in new nurse turnover. Oftentimes there is a high turnover in the first year to 2 years of somebody starting in a role. Organizations have been able to document that they have had a significant downturn in turnover.
Wow, that's amazing.
Mhm.
That's great to hear. And in addition to coaching, what other types of roles do you see RNs do in the patient experience space?
Well, I mentioned analysts, coaching, being the chief experience officer. Many organizations have that chief experience officer reporting to the CNO. And so oftentimes it makes sense that they be nurses.
Okay.
And especially since the bulk of the scores that are part of HCAPS are highly, highly influenced by nurses. So one of the other things too is, right now people hear HCAPS and I see their eyes rolling in the back of their heads,
Yeah.
because they're often beat up over them. but understand them. Understand what the consumer can see when they go to hospital compare,
Sure.
right?
Yeah.
A lot of nurses don't even understand what it is that the consumer can see when picking a hospital, and they can see what the nurse scores are.
Awesome. And now shifting a little bit to just kind of, being an entrepreneur in the healthcare space, what have you found to be some of your favorite things about it?
I think that the great opportunities, I mean, the healthcare industry is changing so quickly, and there's such high demand for healthcare services. There's a high demand for nursing.
Mm-hmm.
Nurses are the most trusted professionals, as we've learned from Gallup since
Yeah.
99, every year at the top, except for 1 year when firefighters outranked us, and that was after 9/11. But nurses are so highly trusted that, it gives us a leg up in a lot of different areas. And I really believe that there are many positions for nurses that we haven't even dreamed of yet. When I started nursing, it was, do you want to work in a hospital or an office? And then
Yes.
public health. That was it. And now you stop and
Mm-hmm.
look at, you're looking at utilization review, you're looking at quality, you're looking at IT. There's just so many opportunities. So I love that about it, and I love the fact that because there's so much change, if you're tuned in, the sky's the limit. Don't wait for a job to be created. See the need and create it yourself.
Yeah. No, I love that so much. And I'd love to see nurses taking up seats at more and more tables because I think they've been missing for so long. And I also think that still, when it comes to nursing education, I still think there is that idea that there's the hospital and then there's, the office or whatever it may be. And that's one thing we're really trying to just educate on around here is the limitless opportunities that are available to nurses should you want them. So and on the flip side, there's always challenges obviously that come with anything. So what are some of those big challenges that you may have faced or understand about entrepreneurship?
Well, I think the biggest challenge is in the beginning, it was scary. It's scary to quit your day job and just
Yeah.
say, I'm doing this, because you have to be everything. When
Mm-hmm.
you start a business, um, especially like in my line of work where you're a consultant, speaker, and trainer, you gotta go out there and get the business. You don't just hang out your shingle and think everybody's going to come to me tomorrow.
Yeah.
So you have to be a marketer. You have to be a strategist. You have to be the accountant. You have to be the head of HR if you're hiring people. But one of the pieces of advice I always tell potential entrepreneurs is know what you're good at, know what you're not good at, and what you hate to do, and stay in your sweet spot and hire the rest out.
Yeah.
Because I knew right from the beginning that I wanted to make sure my business I was doing everything legal. So I hired an attorney and an accountant. So the attorney was keeping me on track in terms of my intellectual property. I knew that
Mm-hmm.
that was going to be important. And the accountant was teaching me about what I had to do to make things work, right? So, yeah, and I started within the first year, I was hiring people to do the operations stuff, internally, the office management, the appointment schedule, the travel scheduling, things like that.
Yeah, that is great advice because you can do everything, but you can't do everything well.
Well, not
So,
only that, but what people pay me for, when you look at where are
mhm.
my billable hours, what do people really want from me that only I can do versus, okay, where do I need
Yes.
help with other things? And I'm not saying go out and hire people full time, but you can hire virtual assistants, you can hire gig workers, to help you with those kinds of things. But know where you're going to make your money,
Mhm.
and don't be spending 40 hours, 50 hours on a brochure when somebody else can do that for you. And you need to be creating relationships that are
Yes.
going to sell your services.
Yeah, absolutely. And to talk about if nurses are at the bedside, but they really are feeling drawn to patient experience, quality, consulting, what kind of skills do you think they can work on developing while they're at the bedside to kind of, set the path for doing those things in the future?
I think number one, communication skills are always going to be vital, no matter what you choose to do. So making sure you can communicate effectively, make your points known without coming across as angry and defensive and things like that. So communication skills are going to be important. I think the coaching skills, when you're talking about patient experience, you need to bring people along, right?
Mm-hmm.
And the reality of it is if you work in patient experience, chances are you are not the boss of the people that you need to influence, right?
Yeah.
Somebody else is the manager, somebody else is their director, and you need to bring people along. Having that power of influence goes hand in hand with communication, knowing your stuff, being a subject matter expert in that
Mm-hmm.
area, reading, trying things, looking for opportunities to take the lead on projects and things around patient experience. Let's say, for instance, that your scores are poor in a certain area, like let's say response time. Okay,
Mm-hmm.
one of the key things we know about response time is that you can preempt the call light by doing frequent rounding, right?
Mm-hmm.
And learning or being a part of a group that is helping coach other nurses on things like hourly rounding or frequent rounding. What are the key elements of making it a positive, successful round versus, kind of a touch and go, or
Yeah. A
the
scan.
scan me like a piece of gum or a pack of gum or a loaf of bread.
Yeah. Yeah, really being intentional about that stuff. And then I think something that we don't do enough as nurses is documenting our results, because that is such a proof of concept of, how good you have proven to do this in the past. So make sure you're keeping track of specific numbers and projects and things that you have had positive outcomes on, because what a better way to speak in an interview in in your next role.
Yeah. Or when you're creating your business and you
Yeah.
say, launch this team internally, and these were the results we got, right?
Yeah. Yeah. So, so
I love
important.
that you bring that up because oftentimes we don't give ourselves enough credit. We're too
Mm-hmm.
humble. We're thinking, oh, yeah, but we can't take credit for that.
Yeah. I say nurses are not good at tooting their own horns, and we need to be.
Right, right.
Yes. Now, how we love to wrap these interviews up is, if you were talking to a nurse who's feeling burned out at the bedside and really considering non traditional roles, what advice would you give them about really creating something sustainable in nursing and something meaningful to them?
I go back to you need that time for reflection,
Mm-hmm.
really thinking about what brings you joy, right? What fills your cup? At the end of a day where you say, that was a great day, let's tweeze it apart and say, what made it a good day?
Yeah.
It wasn't the banana bread in the break room. Mark my
Yes.
words. It was probably that you were doing something that really filled your cup. So identify what are those things. Like for me, I thrive on seeing other people grow, right?
Mm-hmm.
And so, whether it's me as a teacher or me as a coach, I get fulfillment when I see people go, oh, yeah, okay, I get that. Or, thanks, that was really helpful. So, figure that out and then ask yourself, how do I get more of that? And what would it take if I was able to do this piece, consistently? And maybe there's a new niche right within your organization where you can stay, but maybe be that entrepreneur for a while.
Yeah.
Can you work on developing additional skills while safely employed, right?
Yeah. The risk
And
is
being
way
an
lower.
yeah, the risk is way lower, right? But it starts with asking yourself about what is it that I love about nursing? How can I get more of that? So for me with teaching, it was natural for me to be a consultant where I was teaching executives about culture and teaching them about what it takes to be good leaders. So that teaching part was really important. Coaching, honing my coaching
Mm-hmm.
skills so that I could bring other people along and make them better at what they need to be doing. Believe me, I didn't wake up one day and say, oh, this is it. I just kind of
Yeah.
step by step thought, this makes sense. I'm going to go in this direction.
I love that you brought that idea back up of, looking back at your day. And I like how you said tweezing it out, because sometimes it is just such a small detail that brought you a lot of joy, and you can overlook it if you don't think about it, intentionally. So I think
Exactly.
that's so, so important. Well, Kris, thank you so much for sharing your experience and your perspective. And, you are such an expert in this space. It was really fun to have you. I know I learned a lot, and I'm sure our audience did too.
Well, thank you for having me. I really appreciate it. And, hats off to you for starting this whole focus on the non traditional nurse.
Well, thank you so much. And listeners, if this episode resonated with you or got you thinking differently about your own career, make sure you're subscribed to the Non-Traditional Nurse newsletter and share it with your nursing friends. So thanks for everyone being here. I will see you next time.